Pimple popping toenail removals. We've got some fun ones today. Your color commentary and expert derm advice on some of the best reactions from TikTok. So we're gonna jump into it. I've got some fun ones today. And if you stick around to the end, we're gonna talk about ingrown toenails. So if that's your thing, you'll wanna watch that. Okay, we've got a bundle of hairs here coming out. So that is a ton of hair coming out of that small hole. I don't know where on the body this is, but she keeps fishing out these big spools of hair, dead skin cells all wound around there. She's a great one to follow if you guys love this stuff. Bare and neutral. She's got TikTok, Instagram, YouTube, so shout out there. Good job. So this just keeps going, I think. Okay, we got a new patient. Very good. Boom. That's a ton of hair. So it just doesn't have an exit to the skin. It keeps producing hair and it just winds up in a spool with dead skin cells, with oil, all sorts of gross stuff. But it's nice for the patients to get these taken out of there. Probably a little bit tender when they do. But this is great. Comedone extractor, well done. All right, we've got one on the back of the ear here. And no gloves, -1. We've got some dirty fingernails. They've got hangnails, all of that stuff. These are just not ideal to do at home. Can't recommend it. It looks like we're on the back of the ear again. I'm telling you guys, this is a common spot. We still don't have any gloves on. There's dirt under the fingernails. Do better. Just got to do better than this. Clean the area, wear gloves. Ideally, go see the doc, but it's what it is. Don't know if this is in a medical setting here. We've got at least a good looking tool here. It looks like it may be dirty. It's the right kind of tool. Pulling that hair out, the pustule is still intact. Are we gonna come back and we're gonna pop it? Yep, they're just gonna squeeze the top and rip it open. So I'm not guessing that this is in a clinic, if I had to wager. And that skin's being stubborn. They're gonna rip it open and then they're gonna squeeze it. Here it starts to come. They got it ripped open. They're grabbing the hair next to it. There's no reason to pull that out. Guys that get ingrown hairs on the neck struggle with this for years. It can do with, how you shave, what kind of razor you use, but they're obviously tender. This person's letting it grow for a little bit and they're coming in and plucking out those ingrown hairs. They've got pustules around there, probably just with normal skin bacteria. I prescribe like topical clindamycin. It's an antibiotic for patients that struggle with this kind of thing on their neck. Sometimes a very mild topical steroid, but this is just being done at home, it looks like, because we got no gloves, we got the dirty nails. Not the right way to do it. We're switching it up a little bit here. This is an ingrown toenail, and coming at it with some pliers. It does not look like it's been cleaned or anything like that. This is not a medical setting, as far as I can tell. And they're just trying to tease it out of there. The chances are this is pretty painful for the patient. It's in there kind of deep. You can see that they're struggling to get it out, but and they're just trying to wedge it out of there, like wiggling a loose tooth. Slowly getting it out. We're gonna see if they finally make it all the way. Twisting it, that's gonna hurt. I don't know if they're doing this to themselves or if somebody else is doing it. There's got to be more than one person here. Somebody's holding the camera. You got to hold your foot up. You got to hold the tweezers. At least the camera's staying still. Maybe they have it on a mount. Who knows? There we go. Okay. That is it for today, guys. I hope you enjoyed these. Lots of fun watching these with you. And if you have questions about these procedures or like, what do you do to prevent this stuff? Just drop them in the comments below. Subscribing to the channel means the world to me. And every time you watch videos, it helps support my mission to provide free dermatology care. I purchased a motorhome, turned it into a mobile clinic. We're hitting the road, going to underserved communities and providing free skin cancer screening events and helping direct people to their closest dermatologist. So that's what I'm passionate about. And I hope you find some entertainment in this. So I thank you for supporting the channel and I'll see you guys back on the next one.